Okay, so good morning everyone. Welcome to today's Let's Talk Dairy. Today I'm delighted to be joined by Denis Howard from Munster Bovine. Denis is with Munster, I think about 3 years nearly now, Denis, is it?
This was just over 2, Stuart.
Just over 2, sorry, okay. Yeah. So Denis was a vet in practice in the Mitchelstown area for a good number of years before that, and very highly respected vet in practice, and has gone into Munster Bovine now and is focusing on all aspects around the reproduction and herd health with Munster Bovine, working with Doreen and Corrigan, as many of you will know, on a daily basis. So Denis is going to talk to us today in relation to the whole health screening. I suppose it's something that is common in certain parts of the country now, especially the Munster area. More farms beginning to do it, and maybe more co-ops across the country beginning to engage in this area as well. So Denis has some interesting information to show us in relation to the progression over the last number of years since the bulk tank screening came in. And he's going to talk through the diseases that Munster are looking at on an annual basis. So Denis, you have a few slides there that you're going to show us, and we'll chat away and we'll take questions as we go as well, folks, because we'll be moving from one disease to another. So I suppose if you have a question about it, throw it in as we're moving along, and we'll put it to Denis, okay?
Thanks, Stuart. I suppose the herd health programme is on the go since 2013. It is available to all farmers really in the Munster area. So the milk samples are collected 4 times a year. Most of the processors actually organise for the collection of the samples, so there's no effort required from the herd owner's point of view. And I suppose our herd health programme, then there's kind of 3 levels to it. So we call it the gold, silver and bronze. So the bronze is test only, the silver is test plus a phone consult at the end of the year, and then the gold is testing with a one-on-one meeting with one of our own vets at the end of the year. So I suppose the service continues to grow every year, Stuart, and there's just over 2,500 herds there now in the programme. So it's so there's a fair bit of data generated, I suppose, with all those herds, and that's what we're going to try and look at today, is maybe look at some of the trends and some of the learnings over the years. So that's the diseases that are tested for them. So we'll talk about some of the main ones today. So BVD, IBR, Lepto, Neospora, liver fluke, Salmonella, stomach worms. Some others then have dropped out either in the past or recently. And last year then we tested for Q fever and mycoplasma as well. So 2 new tests last year. So we might start off with BVD. And I suppose from our point of view, we test twice a year for it. So it is total antibody test. So that means that it'll pick up vaccine antibodies and the actual antibodies coming from the virus. So in the last 2 years, actually, we've noticed a downward trend in the herds testing positive. So they are starting to drop off. And I suppose that's to be expected, really. And I've a couple of pictures up there that I borrowed from AHI, looking at, I suppose a graph or a representation of the PIs born in 2013 versus last year, and 'tis fairly stark, and 'tis a great illustration in fairness. And I suppose just to put it in context, back in 2013, there was 66 PIs per 10,000 calves born. Last year, there was 3 per 10,000 calves born, so a massive reduction. And I suppose we're starting to see the bulk milk antibodies drop off, and obviously, one reason for that is the number of PIs being born is massively reduced. And the other thing is people are starting to drop the vaccination. And I suppose that's a common question we get is, should I still keep vaccinating for BVD or not? And look, clearly the risk is after reducing massively. The risk isn't gone completely. And I suppose really it is a case-by-case basis.
Yeah, Denis, I suppose the one thing that like I said to you there earlier, that I've never looked at those 2 maps compared to one another. I've just looked at them as we've progressed year on year. They've been reducing, obviously, from the one on the left that people can see on the screen there. And I know people complain a lot about the fact that the BVD tag testing is still in place and so forth. But like, as you said, we're planning to have freedom by 2023, so we're nearly there. And I don't think people actually can quantify, and you'll have seen it probably in practice. People won't actually be able to put a value on what this program has actually done for Ireland in terms of herd health, because BVD was rife actually, and like it was kind of a gateway disease in a way as well, was it? In that
Oh, sure, it was.
Other
Yeah,
stuff was
yeah, sure.
piggybacking on it.
Yeah, I remember back in practice, like the amount of calls you'd get, sick calves or a very poor calf, a calf not thriving, and you'd test this poor calf, that looked like a PI, and inevitably it was a PI, but he was hanging around. The difference back then was he was hanging around for probably months, and he was after infecting all around him. And you're dead right, Stuart, like other animals will pick up the virus, they'll get over it, but there's a big immunosuppression when they do pick it up. And it really, I suppose, made the chances of picking up other diseases, getting pneumonia, getting scour, all sorts of other things. It really increased the chance of them. So it's been a massive achievement. And if we can achieve the freedom by 2023, and that's the aim now, AHI have applied at European level for recognition for the program, like to do it in a decade. Fair enough. There was it could have been a little bit quicker at the start if calves were got rid of quicker, I suppose, but it's still a massive achievement, Stuart, isn't it?
Yeah, and I suppose it's always a challenge. You could say that there was mistakes made at the start of it in terms of the compensation. People were holding out for compensation, and in reality, the compensation was only a tiny piece of the overall piece of the jigsaw, really. But compensation has probably speeded it up all right in the last couple of years. But like that map, it just really drives it home from my perspective as to how bad it actually was. And I really don't think people can comprehend how much damage BVD actually was potentially doing. I mean, empty cows at the end of the year, they're empty cows, but a lot of that could be tied back to BVD in a lot of cases. And also, as you said there, I think Aidan Murray did an article recently in relation to beef herd that they were involved with through the Better Beef or Better Farm program. And significant, as in I'm talking about somewhere in the region of 10 to 20,000 of a cost on the farm as a result of BVD. The small bit of money that we have to spend on the tag testing in the short term for another couple of years is well worth it if we can actually eradicate it completely. Yeah.
So I suppose the push is on now. There's more stringent measures there now. If there's a PI born this year, there's no retesting. The herd is actually restricted for 3 weeks after he's gone. The whole herd must be blood tested. The whole herd must be vaccinated. So it is more strict now as we move into the final phase, I suppose. But hopefully we can get there now by 2023 to be a huge achievement.
And just on the vaccination piece then, Dennis, like I know one herd last year where they actually bought in heifers from a reliable source, but the reliable source was actually bouncing a person who had a PI, and there was PI calves born as a result of it. And there was actually a scour outbreak in the house as a result of the BVD breakdown. But like, would you, in terms, like you said, people are dropping off the vaccination. You don't have a very good knowledge of what's going on around the locality to drop it really at the moment yet, like, would you?
Would, yeah. As I said, like it's all about risk, and the risk is obviously hugely reduced, but it's not gone, and there is still isolated cases, just like you described there, Stuart. So, look, I would be doing my homework if you're an open herd or you're buying in. Some people are still vaccinating their heifers because heifers generally they're on out farms or they're away from home, whereas the cows maybe are at home and they're more secure in the grazing block at home. But and I suppose, look, talk to your own vets as well, because they'll often have a lot of local knowledge about what's going on and things like that. So, but like in general, obviously the risk is hugely reduced. There's no doubt about that.
Yeah, and at the cost of the vaccination as well, then it's like it just really doesn't make sense to drop it until we can say it, until really the country is BVD free. I don't know, would I be recommending that to anybody to drop it? Like,
and I suppose the herds that are dropping it, they probably have been vaccinating with a long time, which means they've got protection from the vaccine, but then they're completely naive. They've no natural immunity, so they're probably quite exposed then as well if they do drop it in subsequent years. So you're right, it's not a deer vaccine. It fits in there with lepto. If you're doing it pre-breeding, it fits in there. So it's not huge effort either. So at this stage, you'd nearly be inclined to err on the side of caution for the last couple of years, really.
Yeah. You've gone this far, you might as well stay the course, basically. Like.
Exactly. Yeah.
So I suppose you're going to move on to maybe the disease that might replace the BVD if it's eradicated.
Yeah, I suppose,
IBR?
yeah, sure. Look, it's likely that maybe there is a program coming for IBR, and there's a lot of reasons for that. I suppose we're a big exporter of cattle, and a lot of countries in Europe now have programs in place. And if our calves or our cattle are going to be passing through those countries, it is likely that we're going to have to up our game and put some kind of a program in place. But that's probably a story for a different day. So I suppose just with IBR, it is bovine herpes virus 1. We test for it 3 times a year. There's 2 tests depending if you're vaccinating or not. So there's the IgB, which tests all the antibodies, both vaccine antibodies and antibodies from the virus. And then there's the IgE test, which just tests the wild antibodies. So all the vaccines are marker vaccines, and this allows you to exclude the vaccine antibodies in the test and just test for wild antibodies, which is very useful when you're vaccinating. You can actually monitor the progress. And I suppose just last year, there was about 340 herds joined our program last year, and 32% of them were positive, which is quite a lot, and it was probably news to a lot of them. And then talking to a lot of them, they would have said, "Jeepers, I don't notice any signs of IBR in my herd. The cows are perfectly healthy, everything is going fine." And that is actually to be expected, because I suppose you can kind of categorize herds in 2 really with IBR. I suppose if you have a naive herd and IBR comes in, then really you'll see the clinical signs in the cows, the high temperatures, the milk drop, the respiratory signs. Whereas if a herd has it for a good number of years, those herds are called endemic. So the infection is in there, they have high immunity, but still the virus is circulating away in the background, and what it's actually doing is holding back production. And Rena Sayers in Moore Park, Stuart, she would have done a big trial on this a few years back, comparing herds that were vaccinating or clear versus herds that had high levels of infection in the herd. And she found no major difference in sick cows, but the big difference she found was in production. And the figure she came up with back then was around 200 litres of milk per cow per year. So I suppose in herds where it is there with a long time, it is really seen more as a production disease. Saying that, you can get issues in young stock, it can cause respiratory issues in calves and young stock, but in the cows, it hits production. So from that point of view, it is low hanging fruit really, and it is well worth going after it. And I suppose the good news is the vaccines work extremely well. That graph I have up there on the right, so that's herds that are in the program and testing regularly with the last 5 years. So that's about 1,300 herds. And that orange line there is actually, you can see the marked reduction year on year in the level of wild antibodies in those herds. And even in individual herds, the reduction would be even better again. So if you're vaccinating, you're protecting the young stock from a young age. So the animals that hadn't it, they're being protected. The vaccine is stopping the shedding in the animals that had the virus. And what happens then is, as older cows that are wild antibody positive leave the herd, they're being replaced by heifers that are clean, that have never picked up the virus, protected from the vaccine. And year on year, then you see the wild antibodies in the herd drop. So you're actually eradicating it back out of the herd again over the years. And in fairness, the majority of the time, that works just like you'd expect. Some herds it doesn't work. And I suppose the most common reason we see for it not working is people are not starting young enough with the vaccine. So they're maybe vaccinating the cows and the in-calf heifers, and they're not doing the calves or the maiden heifers. And what's happening is the young stock have actually picked up the virus before they're vaccinated. They're joining up the herd in, and they have wild antibodies, and the bulk milk isn't changing at all. So that's the most common, I suppose, reason we'd see for it. But absolutely, if you have a good, strong vaccination program in place, you're starting young, when the calves are 3 months old plus, you can actually really reduce the levels of wild antibodies in the herd.
So Dennis, there's there's a live vaccine and a dead vaccine. I suppose my understanding of it is that live should go in kind of the month of June, July period, maybe, so that all your calves that are born in the springtime will be picked up at that stage. And you have to go with a second live visit then in those.
Yeah, so I suppose for all the vaccines, the standard program is the live vaccine every 6 months. Yeah, and you're right, Stuart. My preference would be maybe around Christmas time, so maybe early January, and then June, July, and it fits very well. So you're boosting the cows pre-calving just before the time when their immune system is lowest. And the other thing is then it kind of fits in well, because in June, July, all your calves or all your replacement heifers anywhere 3 months old, and they're old enough to get the live vaccine. I suppose where it gets a bit complicated then is the once-a-year programs. And I suppose Zoetis have a once-a-year program that's the dead vaccine, so they must get a live first, and within 6 months then they get a dead, and it's the inactivated vaccine yearly after that. And MSD have a once-a-year program then with the live vaccine, so you stay on the live, you get 2 shots 6 months apart, and then they go on to the once-a-year live after that. So look, I'd say it's a herd by herd basis. I'm supposed to, as regards the choice of vaccine, we mightn't go into it too much now, Stuart, but
yeah.
I suppose to, talk to your own vet about the choice of program, but I suppose generally, the live twice a year in a heavily infected herd, the live twice a year starting, and then see how you're going. And I suppose if you're monitoring it in the bulk milk and the wild antibodies are dropping, and certainly if they've dropped down to a low level, you can certainly go on to a once-a-year program at that stage. But I suppose it depends on the company. Then they advocate the live or the twice a year versus the once a year, maybe at different stages. So we might leave it.
Yeah, well, it's case by case, really. So
exactly. Yeah,
exactly. Yeah, and then also again, it'd be similarly, I suppose, not different to the BVD. The kind of depending on the loading in the territory as well, it could influence whether you go every 6 months. If you're in a very densely populated area of stock, you probably need to be err on the safe side and do it every 6 months. Yeah,
I suppose the one company are happy enough to go in with the once-a-year program straight away. The other one would prefer the wild antibodies in the bulk milk to be low, so the level, it's well under control before you go in once a year. But generally, in a high risk where there's high levels, you won't go wrong with the live twice a year anyway, that's for sure.
Yes, so there's just one question there, Dennis. Now I know you're getting bogged down in the vaccine now and you didn't want it potentially, but is the once a year live any different from the once a year inactive?
Well, I suppose it's slightly different in that the once a year live with MSD, they do stipulate that they would like the level of infection in the herd to be well under control. We'll say in the scenario of the bulk milk, that you'd be testing with low levels of wild antibodies before you go on to the once a year. So they do stipulate that. Whereas Zoetis, I suppose they're happy to go from the start with their once a year program. But yeah, so I'd say it is a case by case basis, really. Yeah.
Yeah. Very good.
Now, leptospirosis, Stuart, I suppose it's kind of one that gets a little bit forgotten about because there's a lot of other diseases take the limelight ahead of it, especially in the last few years, but it's still very important. I suppose when I looked into this, there was actually only 10% of all the herds were testing negatively consistently. So there is some herds that are testing negative, but they're really few and far between. There's nearly two-thirds of the herds vaccinating, but the big message is there's very few negative herds. That is really endemic in the country. The clinical signs, I suppose in endemic herds where there's a lot of infection, you rarely see, we'll say the milk drop, the mastitis, that kind of thing. But it's definitely still responsible for abortions. I mean, it can settle out in the uterus if a cow gets infected. It can go to the kidneys or go to the uterus. If it's settled out in the uterus, it does affect fertility, conception rates, embryonic deaths, abortions. So it can definitely cause issues with fertility. With calf health, you can get weak calves. And I suppose the biggest, apart from the animal health side of it, it's zoonotic as well. So it is one of these diseases that you can pick up yourself. And I put up a picture of a milking parlour. I mentioned the kidneys earlier on, that it settles out in the kidneys and they can shed it in the urine. And if you wanted a better place for yourself to pick it up, you probably, you couldn't choose any place better than a milking parlour where the cows are up high. You have a hot environment, lots of water. So look, I think it probably beholds everyone really to vaccinate for it. There's very few people that shouldn't be vaccinating anyway, that's for sure. For the health of the animals, but also for, the health of yourself, your parents, maybe your children, family farms. You can have different age groups inside the pit, and then obviously people that are working in the farm as well, that are employed, for their sake as well. So Everyone should nearly be vaccinating for it, Stuart, to be honest.
Yeah, just as you said, predominantly from people's own perspective, but like as you said there, if there's anybody working on the farm, like they actually, there is a concern about people there that you could be liable if somebody picked that up, and basically you'd be seen to be negligible that you hadn't actually been vaccinating hard. So it's something that people should be very conscious of.
Yeah, I think so. Absolutely, yeah. So there's two sides to it. There's the animal health, but absolutely the human health piece as well. So it's not a deer vaccine. It's a very effective vaccine, and there's no reason not to do it. Really, I think.
Yeah, and I suppose Denis, then in terms of timing, there was trouble getting it there a couple of years ago, and there was probably. It used to generally be kind of suggested for the maiden heifers that it was around Valentine's Day and then Patrick's Day for the booster, the second shot. Is the advice around that changing? I think there was some suggestion maybe to move away from the busy period when people are up to their eyes to kind of maybe do it pre-Christmas.
Yeah, personally, I would have no issue bringing it back to the dry period anyway. So actually vaccinating while the cows are dry, I suppose from a cow point of view, it makes sense, instead of doing it in March when the pressure is on as regards negative energy. There's still cows calving, there's cows, on the point of calving maybe, and the pressure is on work-wise as well. So it's a difficult time to try and put all the cows through the crush, and the cows are under pressure, the people are under pressure. So I think pulling it back to the dry period, like either is fine with putting it back to the dry period. There's absolutely no problem with doing it. The cows are dry, or else they're in late lactation, so they're under no pressure, and generally the whole system is under less pressure. So I think it makes sense. It makes sense in certain scenarios, definitely, to pull it back. I suppose another is traditionally then the timing was maybe, we were going out to grass later, and this is to do with your NPH, but as you well know, Stuart, we're going out to grass a lot earlier now. We were chatting about it there earlier on. So maybe there's an argument there as well that they're going to grass earlier. The urine pH is changing, which can, cause animals to start shedding. So that's maybe another reason that you could go in earlier, maybe during the dry period as well.
Okay, very good.
So then Salmonella. So I suppose there's two strains of it there, Stuart. Salmonella Dublin, Salmonella typhonurium. About half the herds in the program, half the 2,500 herds are vaccinating. So I borrowed a graph there from the regional vet labs. This was Alan Johnson presented this there, I'm too sure now, some department webinar before Christmas. And they've really seen a big reduction in the cases of Salmonella abortions and I suppose deaths from Salmonella in calves and things coming into the regional veterinary lab. So there's a clear reduction there in the last decade. And I suppose what is the reason for it? One anyway is increased vaccination. So we see, I suppose, in the graph on the bottom, then there, the last 3 years, herds that joined the program, they realize they're positive. And usually, the advice is to vaccinate because it can be so devastating. And generally they do, so people, it does push people to vaccinate, and vaccination is probably increasing in those herds. Another reason is BVD, like we were talking about earlier on. That was one hypothesis they had, that if there's way less PIs being born, there's less immunosuppression, which decreases other disease as well, including Salmonella. And I suppose another reason is what I'm coming on to next actually is decreased liver fluke, that there is a correlation there between liver fluke infection and the increased chance of having an abortion with Salmonella or having an outbreak of Salmonella. So that's another one. If you can control liver fluke, you reduce your risk as well. So there's probably 3 reasons there, but in general, the trend is down for Salmonella across the country.
Okay, and Salmonella in calves is something that isn't that common, but can be extremely devastating if it does. I don't know, did you ever see that in practice? Yeah, I saw it rarely enough, but I did see it, so you can get, septicemia, so very, very sick calves, bad scours, and it's like they can really go downhill very quickly, dehydrate very quickly, and if they have septicemia, very hard to bring them back. And then you get this necrosis of the extremities, that's a real sign of it as well. The tips of the ears and things like that starting to fall away. So rare enough, but absolutely, Stuart, when it does happen, it's fairly devastating.
And I suppose as regards the vaccination then, you know, I suppose traditionally vaccinating for Salmonella, if it's the calves you're trying to protect, it's a bit like the scour vaccines, you're vaccinating pre-calving. But in the context of our system here in Ireland and the spring, you know, the spring calving grass-based system, the big risk actually comes there in October, November. And part of it is due to the nature of the bacteria. The other part is actually to the stress of cows being dried off. So there's a stress associated with that can actually start, carrier cows can start shedding. And then the other thing, of course, it coincides with housing. And if they're starting to shed, you can get that spread when they're going into the house. And, you know, we've all heard of those disastrous stories with, you know, cows aborting, and a nice few cows can abort if you do get an outbreak. So it can be particularly devastating, whether it's sick calves, abortion, or indeed sick cows. You know, you can get very sick cows with it as well. So, so if it is there, you know, I think it's a real insurance policy to try and, you know, to vaccinate and prevent that disastrous situation happening.
Yeah, I suppose then it's the one thing that sticks out with me. I had a client, and Jesus, a long number of years ago now, it was probably 10 years ago or more, that got actually a Salmonella outbreak in calves in the springtime. And the thing that really struck home with me was he said that he rang the knackery one day to come and collect some more dead calves, basically. And the knackery said to him, "Is there any chance you'd put them into the one spot as opposed to having to drive around the yard to collect them?" Like, it was that devastating. Like, there was calves dying no matter what house he had them in. It was just an absolute nightmare for him. And generally, you would find that anybody who has gone through a Salmonella outbreak, be it abortions or the calf scour, which, as I said, is a lot more rare, I suppose, than the abortion storm scenario, they'd kill to get the vaccine. Basically, at the end of the year, they wouldn't go without it.
Yeah. And the other thing about it can go in cycles. So if she's in a herd, you might see nothing for years, and then something happens. Maybe there's liver fluke on the farm. There's something else going on. Maybe a wet back end. There's stress on the cows, and bang, it can come back again. So, so like, it's one of those ones that it's very hard to predict. And yeah, anyone that has had a brush with it in the past, they'll you're right, they'll go through fire and water to get their hands on the vaccine to prevent it again. You know.
Okay, very good.
So we spoke about liver fluke there, and you know, and that link there with Salmonella, and I suppose, so the graph on the right there, like, we've really seen a downward trend in liver fluke. So that's that 1,300 herds again that have been in the program consistently with the last 5 years, and this is test 4, so the last test of the year. So we test Neospora, or liver fluke, 4 times. And Neospora is the one we test late as well. So we test liver fluke and Neospora there in November. And I suppose this is really to try and pick up those late infections. And last year actually was a case in point with the wet back end. So I suppose in 2016, there was just maybe 46% of herds testing positive, of those 1,300 herds testing positive in the November test. And there was a reduction all the way then year on year down to, in 2019, it was down to just around 23%. So a big reduction, you know, by anyone's standards. And I suppose what is the reason? And I suppose we do have a big focus on the meetings at the end of the year of trying to really target the herds with a high liver fluke reading at the end of the year, and really target those herds to try and get their dosing right and really get a good kill over the winter. So I suppose the first thing is actually to identify the infection. So the bulk milk does that very well. It picks up the infection. It's very, very good for picking up the infection. The next thing is then to try and get the dosing right. So the right product, get the timing right. And one thing we really noticed over the years, and Doreen would always say this, is it is a disaster to underestimate the body weight of cows. And cows can be heavier than you'd think at that time of year in November, December. The last thing I want to do is underestimate the weight. So particularly with triclobendazole and albendazole, they're very safe. So you're better off to err on the side of caution and give them a bit more. Zanil is another story. So that's one thing, getting the dosing right. And then I suppose we test again then in April, and to monitor the cure over the dry period. And all going well, if you get a good kill, especially if you go in early with the likes of triclobendazole, you should get a good kill. and your antibodies should be dropped right back down in the first test the following year. And if you're not getting a good kill, then what is the reason or what went wrong? And I suppose the other thing then is the effects of getting your dosing right every winter, the effects are cumulative. So if you do a good job this year, the cows go out to pasture infection-free, they're going to be, there's less contamination of the pasture. So hopefully you'll have a lower burden the following winter. And you know, if you can repeat this year on year, you can really make a big difference when it comes to liver fluke. So we have, and this will be right back as far as 2013. We'd see I just picked out those 1,300 herds to have a fairly clean set, but that trend is all the ways back. If you can do a really good job and repeat it year on year, you can. And we've had lots of herds that were positive for liver fluke in the past, and are actually clear now at a good number of years and really reducing their winter dosing then, or what winter dosing they're doing. And obviously cows have only one liver, you know, it is critical for health, for immunity, for production. So, you know, it is really critical to try and control it as best you possibly can. There are certain farms that do struggle, you know, down to the land type, but still, you still want to try and get your dosing right. But unfortunately, you know, certain areas they will pick up the infection again the following year, and you're repeating that cycle every year.
But it's also just important then, Dennis, to have a handle on it. Even though you know that you're in a fluky area, you still need to monitor it on an ongoing basis. It's not you just assume that you have a fluke scenario and that you deal with it. Like it's still worth doing the sampling for it, isn't it?
It is, absolutely, yeah. And I suppose hopefully the majority of people do make progress, and you won't know you're making progress unless you're monitoring. And like it is a really good way of monitoring both the infection at the back end of the year and also the response to treatment and how well you got on over the dry period. And
then Dennis, in terms of kind of resistance maybe in those areas, would there be an issue with that potentially?
Sure, it wouldn't be reported, but anecdotally I would say yes, you know. Like there is a lot of resistance to triclobendazole in sheep. I suppose so in areas where there's a good lot of sheep, there is a lot of resistance to triclobendazole, and it's the same liver fluke. So it's the same liver fluke that affects sheep as cattle. And if the fluke becomes resistant to triclobendazole in sheep, it's going to be resistant in cattle as well. So that, I suppose that is a concern. And sure, look, anthelmintic resistance in general is a big concern that, you know, the future of our doses, like there's lots of resistance reported there to the wormers. The work done up in Grange there a few years back to the white drenches. And the ivermectin type products, the macrocyclic lactones, that there is, you know, well documented resistance there. So, you know, not as well documented to liver fluke in cattle, but I suppose if you extrapolate from the sheep, it is a concern for sure.
Yeah, and I suppose just in terms of you were saying about the appropriate weight for the cow for the dosing, like Doreen always says to weigh the heaviest cow or the biggest cow in the farm and dose everything to the basis of that then, isn't it?
Exactly, yeah.
So your Rolls Royce is to weigh every cow obviously and adjust your dose depending on the weight, but at the very minimum, just dose everything to the weight of the heaviest cow would be the...
Exactly, so you will be overdosing some animals slightly, but as I said, the triclobendazole products, the albendazole products, they're very safe. You know, if you do give a bit over and above, it has no adverse effect. Obviously, the Zanil type product then it's a max dose on that. So regardless of the weight, you don't go beyond the max dose because it can be hardening. But definitely, the last thing you want to be doing is underdosing. So even if you do overestimate the weight a bit, I wouldn't be worried about it for triclobendazole or albendazole type products. You know, you're better off to go a bit over than under.
Yeah, so a good story to tell there in terms of the trends in the liver fluke, but constant monitoring is still required though.
It is, and look, I suppose 2020 was a case in point. You know, a wet back end in 2020, and herds that had been testing negative maybe for the last number of years. Sure, you know, they actually popped up again. There was a nice few herds came back positive just on the last test. Not huge high readings now, but you know, they did pick up a bit of a burden there on the back end. So I suppose that is a benefit of the constant monitoring, that you can pick up these these scenarios where infection creeps in again, you know.
Yeah, excellent.
The stomach worms then. So the one that's been tested for is Osteotagia, which is probably the most significant one in cows and cattle and the most common. So there's no real trend. We were looking at this earlier. I was asking you, Stuart, was 16 a wet year, and you weren't quite sure. I'm not quite sure, but maybe there was a wet period. But I suppose one trend is that we tested twice in June and August, and usually the August one is higher. The exception being in 18, the drought had actually dropped off. So, and then stayed quite low the year after, actually. So, you know, the desiccation of that drought really did have a positive effect on reducing parasites. But again, then in the August 20, the wet back end, it rose up again. So it certainly illustrates the weather has a significant role to play when it comes to parasites. So I suppose we're measuring antibodies, so that's what's being measured. And adult animals should have good immunity to stomach worms. So they should have strong immunity. So the question is then, is a high reading, is it a high burden, or is it good immunity? So high reading for sure. If you get a high reading back, you know there's been exposure. So you know that the animal's immune system has kicked in to try and deal with this, with the high levels on the pasture. And the question is then, are they dealing with it themselves, or is it, have they a high burden? And I suppose, like, the big thing for me is I'm always encouraging farmers not to dose just on the results alone. It's all about monitoring. In the future, parasite control really, with resistance and all the rest of it, is all about monitoring. So monitoring performance. In the case of cows, it's the bull tank, it's how they're producing. In the case of young stock, maybe, you know, the live weight gain. Looking at the body condition, the clinical signs. In the case of lungworm, which we don't test for now, is you know, coughing. You're always looking out for the clinical signs for lungworm. But for stomach worms, then, you know, are the cows looser than they normally are? So looking at performance, looking at clinical signs, keeping an eye on the weather. You know, if there's a wet year, you're going to have a higher chance of high burdens, and then bringing in your diagnostics as well. So you're trying to look at everything and decide, do the cows need dosing? And I think the day for, you know, this routine dose, saying, yeah, I dose my cows every year and in the 1st of June, you know, I think the day for that is gone, and we must try and do more monitoring. And if they need to be dosed, absolutely. But if they don't, you know, you'd prefer not to be dosing, because every time you dose them, you know, you're affecting the immunity, especially with maybe the porons, you're affecting the cow's immunity. You know, they can be quite toxic to insects and the dung beetle and that kind of stuff, and those fellas, which are our friends when it comes to parasite control. So we want to try and reduce our dosing, but at the same time, when we need to dose, we want to have the products there that'll work and do a job for us.
Denis, do you see it in the future? I don't know if you've had any discussions yourselves. Like, do you see the milk recording feeding into this, we'll say, in terms of individual cow data? Yeah, I suppose it'd be nice, wouldn't it, that if you could correlate production, individual production, more with the likelihood of, or correlated more with performance, and the likelihood of maybe a parasitic burden or whatever. Yeah, and I suppose, look, in that scenario, you're talking about selectively dosing, Stuart, is it? Yeah, Denis, yeah. Because, like, you know, when you look at the stuff that Lisa Ring has done with ICBF in relation to the liver fluke resistance, the breeding for that, like, I just wonder sometimes, is there something similar maybe in terms of stomach worms, that some are going to be more resistant than others? And you look at our own herd there, from time to time you'd see cows that are a little bit looser than other cows, and you just wonder, are they just more prone to the stomach worm than if they were dosed? Then would that sort them out, you know?
And age as well, you know, older cows are likely to have stronger immunity than maybe the heifers coming in the first or second lactations. The likelihood is that their immunity might be a bit weaker, you know, the stress of joining the herd and all the rest of it. But yeah, I think, you know, and in that scenario, selectively dosing the first lactations, if you think they're struggling, I think is a good thing. I suppose the one thing I would say there, if you are selectively dosing during the summer, I would probably veer towards the injection rather than the poron, because, you know, if you use a poron and say just the first lactations, they're going to be rubbing off each other inside in the collecting yard. You know, there's a certain amount of licking and things like that goes on, which means some of the other cows then are going to be getting a very low dose, which you'd imagine couldn't be great for preventing the development of resistance. So in that scenario, I would say that the injection is probably a better bet if you're selectively dosing your heifers or something like that.
Yeah, and that would tie in with Orla Keane would have been on with me last year during the summer as well, and she would say that the injectable would always be the preferable option if possible.
Yeah, yeah. I mean, not that the Poran obviously doesn't, but certainly if you're selectively dosing, you'd always, Poran is kind of designed to do every animal, whereas because they're all going to be rubbing off each other and licking each other anyway. Whereas the injection, obviously, it is going under the skin and it's not going to be spread around.
Yeah, I suppose it's just to emphasize that people should realize that the Poran, part of the Poran element is that they actually do lick it from one another. Is kind of part of the idea of the whole process. Like
it is, yeah. So yeah. So look, I think you're right that selective dosing is probably a good thing. To target the animals that need treatment rather than targeting the whole batch. But I would be cognizant of that. All right, it should for cows during the summertime, there's no oral drench that has no milk withdrawal, so you're talking injection or Poran. And if you're selective, I'd be inclined to veer towards the injection anyway.
Yeah.
Neospora then, Stuart. So I suppose there's no harm maybe to go into a little bit of the process of how the disease transmits here. So Neospora caninum is a single cell parasite, so it is a protozoa. And another thing before I forget it is to mention that the number of animals being tested here is quite important. So if you have 5 positive cows inside a 100 cow herd, you'll probably come back with a high positive reading. Whereas if you have 5 cows inside a 500 cow herd, you'll probably come back with a negative reading. So the size of the herd is important here when interpreting the results. So then if you do have a positive cow inside in the herd, she doesn't spread it to her comrades, that's the first thing, so she won't spread it to the cows around her. But when she calves, she'll always have a positive calf. So that's called vertical transmission. And obviously, if that calf is a replacement heifer, she'll go on and go and calf and join the herd again. So that's vertical transmission from cow to calf. Then it gets a little bit more interesting then when that cow calves, her cleaning is infective to the dog or the fox. So if her cleaning gets into the mouth of a dog or a fox, he becomes infected and he actually sheds until he gets immunity. Then he'll shed. He's the definitive host. That's the first thing. So he completes the life cycle of the parasite and he sheds the eggs out his rear end. And if that gets into the feed of your cattle or your cows, whether it's water or contaminated feed, that's called horizontal transmission, and that'll infect your cows. And that's really where you see the abortions. So if that happens in a herd that's uninfected or to cows that are uninfected, they have a really high chance of aborting. And that's where you get the abortion storms coming with Neospora. The other side of it then, the vertical transmission, when they're infected in the womb, generally they go on fairly normally, they go on calf and they have a less chance of aborting, but they have a higher chance of leaving the herd. So they have a higher chance of not going calf at some stage or losing a pregnancy and leaving the herd. So I suppose with that in mind then, there's a couple of pieces to controlling Neospora inside your own herd. So number one, and this is for every herd really, is the horizontal transmission. And that's from cow's cleaning into the mouth of a fox or a dog and back again. So the first thing there is to try and manage the afterbirths so they don't get into the mouth of a dog or a fox. And the next thing then, which is easier said than done, is to protect the feed. But look, if there's obvious things happening in the feed face, if you're using a diet feeder, if you're feeding beet or something like that, where foxes could be hanging around, get off the loader and have a look around to make sure there's nothing around. It shouldn't be before you go loading. So there are certain things that you can do, but I mean, you can't do a whole lot about out in the pasture and things like that. The next part then is the vertical transmission. And I suppose if you want to make progress within the herd, if you have high levels and it looks like there's vertical transmission, the only way you'll make progress is to actually go test the cows individually. So if we look at the graph here then, I've plotted the 4, I should say Patrick Kelly, I should mention Patrick Kelly here because he's the man to put these graphs together. So he plotted the four tests every year. And you can see there's a clear trend that the last test every year is the highest antibody reading. And there's a reason for that. So cows that have Neospora, the parasite becomes more active during the pregnancy, the cow's immune system responds and the antibodies shoot up. So you'll always get the highest reading in the bulk milk during the year. And also then it's the best time to test the herd individually is late in the year. So if you're blood sampling, you know, during the dry period ideally. So you want to test the cows in the second half of pregnancy. So then if you do that and you identify the positive cows, you'll also, the positive cows and the positive in-calf heifers, you'll pretty much know your weanlings as well then, because you can trace them back to what cows they're off, and you'll know the next crop of calves. And then you can make the decision, if a positive cow, if she's kind of lined up to go, well and good. And if she's staying, she's hanging around to make sure you're not breeding any more replacements off her. So I think to something that's worth doing in herds that are testing high, and you'll see the overall trend is actually an increase over the years. So that's that same 1,300 herds again. Back in, there was about over 20% testing positive. This is in 2016, and it has risen up to maybe 27% or something like that there in 2020. So I don't know, Stuart, maybe herd expansion. There's been a good lot of, you know, people retaining cows, maybe carrying over cows, a lot more replacements bred, obviously, movement of animals as well. So maybe that has something to do with it.
Yeah, so Dennis, just out of interest now, we'll say cows that turn up empty at the end of the year. Is there, like, on the basis of what you said there now about the parasite becoming more prevalent during the pregnancy, is it very hard to detect if they actually were empty as a result of Neospora at the end of the breeding season then?
It is, because if the pregnancy is gone, the antibodies drop down again. So even if they're a positive cow, they have a lower chance of testing positive if they're empty. You know, yeah. So, but certainly if you have high readings in your herd, you know, you'd be very slow about recycling cows anyway, or giving cows a chance to come back around again, because even testing them, they could test negative.
Yeah, like the reason I asked that question is I've often heard people say that they've tested their empty cows because they felt it might be Neospora, and they all come back negative.
Yeah.
So
So I mean, this is the bulk milk, like, but there is obviously, it is a fairly clear trend. All those spikes are in late, you know, that's the November test.
November test, yeah.
Yeah, so the antibodies are rising up. So the parasite becomes more active, and the antibodies rise, so the test becomes more sensitive the later in pregnancy you go.
Yeah, and the other thing that my train of thought is after kind of half neglecting me now, but I was talking to one of the advisors in Kerry yesterday, and he was actually talking about Neospora in a herd that he was dealing with, and what he was finding was that they were actually served in the first 3 weeks, no sign of a repeat for the full breeding season, and maybe 2 to 3 weeks after breeding was finished, these cows that were deemed to be in calf to the first service in the first 3 weeks, next thing breaking down. So that's and it was that was subsequently confirmed as being Neospora in the herd, and are breeding their way out of it now at the moment. Breeding their way out of it mightn't be the right terminology, but they've, like you said there, they've stopped the vertical transmission by not breeding replacements from those cows that were identified, and they're beginning to get out of it now. Like, but just like that's all that's trying to see a cow break down after a full 12 weeks nearly. Like, and if people, I'm just trying to emphasize that people should probably be looking at these things if they are seeing them on their reports coming back as readings. Like,
and the individual testing is not something you need to do every year. You know, you do it, try and run with that then for a few years and see how things are going, and maybe test again after a number of years. And the other thing, Stuart, what's the latest figure on the cost of putting a replacement heifer milking in the parlour?
So we rounded at 1,500, including the labour and everything. Like,
yeah, and the effort that goes in, you know, to get her there. I think it's a shame then if she's Neospora positive after going to all that cost and all that effort. So definitely, I think you'd prefer to be breeding your replacement heifers of Neospora negative cows anyway. So, and the only way to know that, if you have a high reading, the only way to know that is to go and test.
Yeah, so you've just 1 or 2 more slides now, I think, is it, Dennis?
So they're getting scarce now, Stuart. I kind of ran out of steam a bit here. But so yeah, you mentioned that you wanted, I suppose we did stop testing for a few diseases in 2019, and we added a couple in there last year, Q fever and mycoplasma. So so whichever you want to talk about now, Stuart, if you want to keep going.
Yeah, I suppose the Schmallenberg is something that was very prevalent at one stage, and it was interesting. I was talking to one of your colleagues there about it last year, and it still does actually flare up from every now and then. And it was an interesting cycle in it, that there's a little bit of it in a herd. There's probably no harm from the point of view of kind of keeping immunity in the herd.
Yeah.
But I suppose the thing that was of most interest to me was the PI3 and the RSV, because of having had some herds that I've been dealing with that were running into problems with IBR vaccines supposedly breaking down, but subsequently finding that it was PI3 and RSV issues in herds of cows. Now, it's not very common, but it seems it was an issue. And like all herds, basically, from what you're saying, they were testing positive for PI3 and RSV in their milk samples, which is to be expected. But I suppose the fact that you stop testing for it doesn't mean that PI3 and RSV aren't a potential risk factor for farms. Like,
exactly. So with the value of the test, I suppose we found that nearly all herds were testing with a high positive for RSV and PI3, and that's to be expected. So pretty much any cow you blood test with antibodies to RSV and PI3. So every animal in the herd must pick it up at some stage. And I suppose if they're picking it up as young calves, you can get pneumonia in young calves. If they're picking it up at housing, when you're housing your weanlings, you can get respiratory disease and pneumonia there. But other than that, they do pick it up at some stage, whether it is at grass, a bit of a cough or whatever. And generally, if it is not at housing, it is not as young calves, generally they'll pick it up and put it over themselves without any major issues. But saying that, I suppose with the way the whole antibiotic thing is going and everything, like there's a really compelling case there to be vaccinating your weanlings pre-housing, and probably vaccinating your calves as well, your young calves up the nose for RSV, PI3 to try and prevent it in the first place. And you're right, Stuart, like even that it's in herds of cows, like generally most herds won't see any issues with it, you won't see any signs, but it does rear its head in some herds then, and it can be often, maybe lungworm is becoming a big issue every summer, and it can be often on the back of that. It might start with lungworm, and that creates the conditions for this virus to start circulating, and absolutely then it can cause an issue and keep circulating in a herd. And I think often herds, my experience anyway, is the better the production. So herds that are really hitting their straps there in May, June, averaging 30 litres plus, they are the herds I think that are a bit more susceptible, that those cows have a little bit of a reserve, less of a reserve to fight off these viruses and things at that time of year. So you're right, just because we stopped testing doesn't mean they're an issue, but I suppose the value of the test was limited, we thought, so we replaced it with something maybe that we hope would add more value.
Okay, so and just to what you replaced it with then was the Q fever and the mycoplasma. So there's one question in there in relation to the Q fever in particular, that some herds have seen some very high readings. So just to maybe address that and your thoughts on it.
Yeah, so over half the herds we tested anyway came back positive. It was up around 60%. So it's even more prevalent than would have been previously thought. It was the last kind of study that was done, it was a few years back, and I think it was down around 30%. So it seems to be on the rise. So it is a bacteria, that's the first thing. It is a Coxiella burnetii bacteria. It's not hugely significant, is my feeling, in cows, that they'll pick it up and put it over them. And a lot of those herds, those high herds that had high readings, they certainly didn't notice a whole lot going on anyway. Saying that, it can cause abortion, so it can cause the odd late-term abortion if it gets into the placenta, or you can get weak calves being born. And I suppose the way it comes into a herd, even if you've a very good disease status and you're a closed herd, ticks can bring it in. So, and I've seen that in herds with really good disease status, that Q fever has come in. So ticks can bring it in, but then the main spread happens at calving time. So they shed it in the calving fluids. That's where the main spread happens within herd. And I suppose the bigger thing I think with it is one of these zoonotic diseases again. So you can pick it up yourself. The big risk is at calving time, dealing with cows calving or dealing with wet newborn calves. And I've certainly spoken to farmers that had it diagnosed, which is probably one of those things that's underdiagnosed. Again, flu-like symptoms, quite mild in most people, but the odd person can get sick. So I did speak to one man, his father spent a couple of weeks in hospital with it. and he had a very high reading in the bulk milk tank, and he was actually diagnosed with Q fever. Spoke to another man, we had a conversation there in the autumn, and he didn't tell me at the time, but he was out of sorts a bit, and he went away, got tested, and he was diagnosed with Q fever. So so it is a risk, and calving is over now, but really, hygienic calving, wearing gloves, and looking after yourselves, and a bit like lepto, everyone on the farm, young and old, and people working on the farm with you to put measures in place, I suppose, to protect yourselves. Mycoplasma bovis is another bacteria. So about a third of herds came back positive, which, talking to Catherine McClune, UCD, that would be kind of what you'd expect. So it is endemic in Ireland. We've heard a good bit of it over the last couple of years about mycoplasma in New Zealand and culling herds and all the rest of it. So they thought they were completely clear of it, and then it showed up in some herd, and they really went after it, testing to try and get back their free status again. It's a bit different in Ireland. There's a lot of movement of animals, and there's a lot of herds that would be testing positive. Saying that, luckily, in a well-managed herd where stress is low, nutrition is good, and cows are well looked after, good housing, etc., it seems to, we'll rarely see signs of disease. So the signs of disease, it can be bad mastitis, a contagious type mastitis that can spread to all four quarters, the joint infections, so swollen, painful joints in cows. It can be part of pneumonia in calves. Another sign of it in calves is ear infection, so one ear dropped down. So if it rears its head, the symptoms are very nasty. There's none of those nice, and they can be fairly devastating in certain situations. But I suppose it's a bit like other bacteria, just say Pasteurella pneumonia. Pasteurella is always in the herd, but it hops on the bandwagon if something else is going on. Mycoplasma is a bit like that. If there's some other disease, our cows are stressed, our housing isn't, lack of cubicle space, lack of ventilation. Usually there's something else going on that gives mycoplasma a chance to get going, such as regards prevention. There is no vaccine at the moment anyway, so prevention really is all about looking after cows as well as you possibly can, keeping the nutrition right, getting the cow comfort as good as it can be, and keeping the stress levels low.
Okay, very good. So there's, in relation to the Q fever, is there any vaccine for that? That's one question that's just come in there.
There is a vaccine actually. There's a vaccine licensed in Europe, and I presume could be licensed in Ireland very quickly. So yeah, I'd say the jury is probably out. Is it something we need to vaccinate for? It certainly doesn't seem to cause huge issues from the cow's point of view. The human health part of it, is it a bit like lepto, that it's something that should be controlled? I'm not sure. There's probably more work needs to be done, I'd say, Stuart, to establish the need for vaccination, or maybe the actual significance of the disease, full stop, really. So,
okay,
but
very good. And then just John O'Sullivan is asking then as well, could using porons during the summer keep Q fever under control? So we'll say managing the ticks scenario with the likes of your spot-ons and so forth. I
suppose it could, like certainly herds with tick-borne fever, that's what they're doing to manage it, maybe going in once a month with a spot-on or whatsoever, or whatever. Is it worth doing it for Q fever? I'm not so sure. Like it's got into a lot of herds now anyway. As I said, the main spread happens at calving time, such as the cows shedding it themselves at calving. That's the main way it spreads. You're not going to stop that, and you'd have to be really religious with your porons, and I'm not so sure it is warranted really to be that religious with spot-ons every month for Q fever. So, but again, probably more work needed there, Stuart, to see the significance of that.
Yeah, and I think even Dennis, you said it earlier as well about the dung beetles and so forth. I think the likes of the spot-ons are actually have a negative effect on them as well, don't they? I'm pretty sure.
Yeah. So yeah. There's a balance there, isn't there? Yeah, and on balance, I'd say probably no, unless there was tick-borne fever. Now is a different situation where you can be getting respiratory disease and milk drop and all that kind of stuff. So it's really affecting the cow. Q fever is not really affecting the cow that much anyway. So tick-borne fever, I would say yes, but Q fever, probably on balance, no.
Yeah, and just going back then into the presentation before we wrap up, then there's two questions. One is relating to the IBR again. If you don't have IBR issue and vaccinating using live, is it better to stay on live all the time or change to the inactive?
If you've no issue, if you're testing completely clear and you're vaccinating purely for prevention, I don't think it matters which program you're on, to be honest, whether it is the once a year live or the once a year dead. So the virus isn't there. What you're trying to do is keep it out. And I think once a year vaccination, whether it is the once a year live or the once a year dead, is sufficient in that scenario.
Okay, very good. And then the final question that's here at the minute anyway, is it not better to blanket dose for worms as cows dosed would cough up worms and then the cows not dosed would ingest these?
Say that again now, Stuart.
So the way we were talking about the selective dosing, so that you're saying that if you were to dose the heifers and they're obviously in the herd, this person is asking if they shed out the worms following the dose, are the cows that aren't dosed going to pick that up then?
Yeah, I suppose in any herd, there's always going to be a low level of worms anyway, so they're going to be shedding out. There's going to be contamination of pasture at a low level. And that's actually what keeps the immunity topped up. So you kind of want that in a way at low level and keeping the immunity topped up. I suppose what we were talking about is if certain animals in the herd have low immunity to start off with, like your heifers, and the rest of the animals have strong immunity, should you dose? If you could dose those animals selectively, it would be a positive, I think, because you're using less dosing and you're not affecting the immunity of the rest of the herd. So as regards the animals shedding out the worms, that shouldn't have any effect on the rest of the herd.
Okay, very good. So we're up to the hour now, Denis, so we'll wrap it up with that. I'd just like to say thanks very much for coming on today. I found it very interesting. I think what I'm taking from it is using your vaccines and using your dosing appropriately is critically important, and all your evidence would be suggesting or would be showing that, like, where they're done correctly, they're having a very positive effect on herd health. And I'd say something that we have seen, I suppose you could say that it's quota related, but also maybe herd health related, is that the increase in production in farms is improving year on year in reality, and a lot of that could be down to a lot of the herd health program that has been implemented since 2012, 2013. So I think the way I've always described it to any groups that I've been dealing with or clients that I've been dealing with is herd health, like you go into Denis Howard or you go into any vet around the country and you're buying a product from them, you have to write a check or you have to transfer money into their account for this product, and you see the cost associated with it, but you never really realise the financial benefit from actually doing that. And I think some of the stuff that you showed there is probably emphasising that spend on herd health can't be underestimated in terms of the value that it's giving in terms of both production and kind of labour management. People talk about animal health and labour. Like, good healthy animals don't require as much work as sick animals. So, like, I think there's great information shown there today in relation to the trends in animal health over the last number of years, and we should continue to try to develop further on those, and more people should be looking at vaccination that aren't looking at it, obviously in consultation with your own vet, but and for, like you said, 2,600 herds on the screening at the moment. There's scope there for more, and people should be looking at it, I think, as a real, like, it's like the gold package, I think, Denis, is it 290 or 300 euros or something for the year?
It's 349 for the
349 for the gold, yeah. Like that, and that's your consultation with Denis or Doreen or some other vets that are working with Munster as well. And that's a small drop in the ocean in comparison to what you could spend on anything. Like, I mean, you could drop 350 quid on a couple of sick animals in over a day or two quite easily and still not be at the bottom of it. So I think herd health monitoring, like when we take into consideration the whole selective dry cow and the anthelmintic resistance, as you mentioned there earlier as well, like this is the way forward. People need to be monitoring it, to be getting access to medication in the future, could be even tied into this. The opportunity is there to be involved in it now. I think people should be looking at it. It's very, very, very much an influential aspect of how your herd is going to perform from a fertility point of view, from a milk production point of view. Like the liver fluke alone, then it can influence protein production in the farm as well. Like if there's a burden there, protein is going to be down, because, as you said, the liver is literally the powerhouse of the animal, and if that's not functioning right, they're not going to be functioning right. So I think it's very interesting. I think we might get you back again in due course to talk about some of the reproduction point of views and maybe milk recording as well during the course of the year. But thanks very much for coming on today and for giving us that update. So we wish everybody the best for the week ahead, and we wish you a happy St. Patrick's Day.